Okay, we're continuing with the book here, Prevent and Reverse Back Pain by me, Pete Rogers. We're on page 36. This is chapter 4, Osteoporosis and Spine Fractures. Okay, so it says, I had a lot of surprises in my life, not the least of which was being my ex-wife becoming Lord of the Rings after the marital ceremony. And Herbert Spencer's quote, at the wedding, the woman gets a ring on her finger, the man gets one in his nose. Okay, so my big surprise in nutrition was that milk causes osteoporosis, because all of my time growing up and in the schools, they tell you you need milk to build strong bones. But the reality is milk actually increases the risk of osteoporosis, softening of the bones. So what is cow's milk? It's liquid meat. What is cheese? It's meat jello. And what's unique about dairy foods? When you eat them, you end up looking like the animal where they came from. Okay. What's unique about cheese pizza? It looks the same in your hand as it does in your arteries. Cheese pizza is like what an atherosclerotic plaque looks like. Who gets osteoporosis? Little old ladies who drink milk. They get the most severe osteoporosis. Why does milk cause osteoporosis? Because animal protein is acidic. In particular, animal protein has more of these amino acids that get metabolized to acid, like methionine, going to, in part, to sulfuric acid, leading to a metabolic acidosis, and the body has to buffer the pH. It takes some calcium from bone, some from muscle, and then the kidney co-excretes that with hydrogen protons. So you get calciuria, and the calciuria can precipitate in the kidney tubules, cause kidney stones. But in a sense, you're peeing your bones into the toilet, so to speak, and that leads to osteoporosis. Okay, what's the number one risk factor for type 1 diabetes? Dairy foods. Does dairy food increase the risk of complication? Yeah, it kind of slows down gut peristalsis, so it can cause constipation, and it increases your risk of leaky gut, of autoimmune disease, of multiple sclerosis. Why is meat so acidic? Because it's got more amino acids, like with sulfur side groups, like methionine, for example. What does osteoporosis have to do with back pain? It softens the vertebral body end plates. You'll get more Schmorl's node disc herniating into the end plates, but you'll also get more fractures, more compression fractures in particular. Schmorl's nodes with disc herniates into the vertebral body itself. They can be painful in the acute phase. Usually it's temporary, though. How long does the pain last with a small nose? It's variable. Can a Schmorl's node into a vertebral body disc herniation progress to a fracture? Sometimes it can dig its way all the way through and fracture the vertebra. It usually doesn't. It usually stays the same for years and years. I've seen many, many thousands of them. It's sometimes hard to tell on an MRI if one's looking at a big Schmorl's node versus an upper end plate compression fracture. Compression fracture is like a wedge deformity in the vertebral end plate. Fuzzy judgments like these help protect neuroradiologists from being replaced by nurse practitioners and artificial intelligence robots. Okay, does osteoporosis cause vertebral body fractures? Yes, it can certainly cause compression fractures and burst fractures. Okay, what is a compression fracture? It's a wedge-shaped flattening of the vertebral end plate, usually the upper end plate. But the posterior end plate's intact with a compression fracture. When you have a burst fracture, then the posterior end plate is broken, busted. Do vertebral bodies have anterior and posterior end plates? Well, theoretically, people say officially there should only be an upper and a lower end plate in a vertebral body. But in reality, we always call the posterior part the posterior end plate, even though that might not be the most precise terminology, because you got more cartilaginous-like bone on the upper and lower end plates, whereas you don't have that throughout in the posterior end plate, but it's just effectively as easy to say. And the relevance of the posterior part of the vertebral body is it's the part that's closest to the spinal canal, meaning to the cord and the nerve roots, okay? So we call it the posterior end plate. Okay, why is the posterior end plate such a big deal? Because it's next to the cord and the nerve roots. Okay, here's a picture of the Bantu lady in Africa, okay? The Bantu women in Africa would have like 9 or 10 kids. They'd nurse each one of them 2 or 3 years. They get hardly any calcium in the day, about the equivalent of 350 milligrams. Yet they don't get osteoporosis. Why? Because your bones are not just calcium. We don't say the calcium bodies. We call them vertebral bodies. Calcium is just one small part of your vertebrae. Okay? So the point is, even with a low calcium intake, they don't get osteoporosis because they don't drink any milk. Bantu women in South Africa. Okay, and all women used to have 9 or 10 kids before birth control. and they get hardly any osteoporosis. They exercise a lot. How about Eskimo women? They get lots of osteoporosis because all those animal foods having more acidic protein. Are calcium supplements a good idea for prevention of osteoporosis? I don't think so. People who take over 1,400 milligrams a day of calcium, they have a 2.6 time increased risk of death. It's thought that they get a transient hypercoagulability because calcium in and of itself functions like a clotting factor. So if you give yourself a big bolus, you transiently make your blood very prothrombotic, prone to clotting. What about Western women? They only have 1.5 babies, but they drink a lot of milk, quite often eat meat, cheese, and they get a moderate amount of osteoporosis. Okay. Oh, here's a nice painting of a lady with her baby. This one by Francois Delobe from 1860. How are compression fractures graded? I made a little joke there, but all fracture classification systems are barely busted, moderately busted, severely busted. Depending on how much loss of height in the upper end plate and the vertebral body's height, that's how you classify compression fractures. What other problems can they cause? They can cause a kyphotic angulation of the thoracic spine, for example. It's called a hunchback or dowager's hump. It can be at multiple levels. They can be quite painful. They can have if it's just a compression fracture, though, that's it. CT is the best way to show compression fractures in terms of whether or not the bone's fractured, but MRI is better for showing the medullary space and whether or not the fracture is acute, because an acute fracture is going to have some edema typically. How does one diagnose the cause and chronicity of a compression fracture? You get an MRI. That's how you can time it, because it won't be edema when it's old. What's the most common significant mistake when imaging thoracolumbar junction? Well, looking at a plain film and calling it a compression fracture when it's actually a burst fracture. You just can't tell in a plain film. I said when a baby sees a basketball or a beach ball, it says ball, but a spine doctor is expected to know the difference. What's the difference between a compression fracture and a burst fracture? Posterior end plate's intact with a compression fracture. It's broken with a burst fracture. Okay, does it really matter to correctly diagnose a burst from a compression? Yeah, it does, because when the posterior end plate's disrupted with a burst, it can go back and push on the cord, the caudal equine, and the nerve roots and cause neural injury. Why do so many people confuse compression fractures and burst fractures? Because on plain films, you can't tell the difference. But on CT, if you know what you're doing, you should be able to easily tell the difference. All right, that's it for this chapter. I hope you found that helpful.